Hey guys, Dr. Dragoda here. Welcome back, and today we're going to get into rehabilitation of the shoulder. And all too often patients would like to get into a good habit of starting to get into some exercise program following some sort of sprain strain of the shoulder or post-surgical, but sometimes they could be doing themselves more harm than good, like progressing too fast with weights or bands. So if you're newly off an injury such as a rotator cuff sprain, strain, or even a tear, maybe some sort of surgical intervention, what you'll find is that your shoulder is extraordinarily weak. So progressing to a band or full-blown range of motion may be a little bit too much too soon. So what we'll do here is do isometric or that type of positioning or that type of rehabilitation. So isometric is adding a force without shortening or lengthening that muscle, so it keeps it into its position. So in this position, what we're going to do is we're going to pretend it's my left shoulder, so the side against the wall, and all you're going to be doing is meeting the resistance of the wall. Obviously you're not going to be able to power through the wall, so all you really want to do is just meet the resistance of it. So you're going to stand up nice and tall, and the first thing we're going to do is abduction. So just something like this. And all you're going to do is just push into the wall for about 8 seconds as a minimum, and then you're going to release. The reason I like 8 seconds is because it takes approximately 2 seconds for that full contraction. You want about 2 seconds for that sustained contraction, and then as you ease out of that contraction, it will give you a little bit, it'll kind of give you time to ramp down. So this way you get at least 6 seconds of full contraction, and then you allow some time where you're not fully firing. So this way you really get that muscle to fire through the whole length. So that's 8 seconds. And then you release, 8 seconds, and then you release. And then you probably would want to do that about 5 to 6 times, maybe even more depending on the injury. I would probably recommend 5 times, but do multiple movements. So we have abduction, we have external rotation, and then we have some other ones, but these are really good ones to start. So the external rotation will look just the same. You might be a little bit closer to the wall in this case, and instead of going out like this, you're going to pinch your elbow to your side and you're going to rotate. So it's almost like the back of the wrist will be hitting into the wall. So it'll look kind of like this. 1, 2, 3, and then you get to an 8 count and you release, and like that. You can also do internal rotation, but that's a lot harder because you're going to have to kind of come out to the side, and that might be a little bit more vulnerable on the shoulder at this case. So again, this is a really good starter rehabilitation for patients who are having shoulder pain and again are just off of a sprain strain of a rotator cuff, a tear, or just off of surgery. And this is a great way to get your rehabilitation started without progressing too quickly. So give this a try, guys, and I will see you next time. Thanks again for stopping by, and tune in next week. Take care. Bye.